Thanks for tuning into the program today. I'm your host, Neal Howard, here on Health Professional Radio. You know, when you talk about shingles or herpes, maybe cold sores or warts, these things aren't life-threatening, but they can severely impact the person's quality of life. And our guest today is Cheryl Myers, a registered nurse and natural health expert, lecturer, and author. She's joining us today to talk about some natural, safe, and effective solutions to treat some common viral infections. Welcome to the program, Cheryl.
Thank you. I'm delighted to be here.
Give us a bit of background about yourself. You're a registered nurse, you're a natural health expert, a lecturer, and an author. Quite busy.
Yes, I am quite busy. I'm very interested. I started out in mainstream medicine. My first degree was in nursing. I have become very interested in natural interventions that have scientific validation. Now, this is not just I'm taking it because my neighbor said they liked it. I'm taking it because it has a pretty package, but things that actually have research behind it. And it turns out that there's a multitude of natural interventions for health that can be quite effective. Now, when it comes to viral illnesses, we don't have a lot to offer in mainstream medicine. We have medicines that can try to alleviate some of the symptoms, so the itching or trying to get the blisters to heal more quickly, for example, like with a cold sore. But we don't have a lot that really addresses the virus itself. Conversely, when we look at natural medicine, there are compounds that can make a real difference in people who are struggling with viral illnesses. Some of the most common, which you mentioned, things like shingles, which arises from the chickenpox virus. That seems to cause a lot of problems with people today. When we look at, for example, HPV, the virus that is associated with, unfortunately, cervical cancer, that viral infection. So there's lots of different things for which we may need to look outside the box, so to speak, outside of mainstream medicine to find real solutions.
Now, these compounds are effective on viruses, but not on bacteria. People seem to get those two confused.
The difference is that bacteria is a different kind of they're all called microorganisms, which just means little tiny living things. These microorganisms that cause disease are called pathogens. So not all bacteria cause disease, but the ones that do cause disease can cause a lot of problems. We have drugs to treat those, antibiotics, and there's some other things they can use with bacteria. Viruses are a different type of microorganism entirely. They are incredibly, incredibly small. In fact, it wasn't until less than 100 years ago that scientists could even agree that they're alive. They are so small, and they had difficulty figuring out how they function. They are so tiny that if your cell was a baseball field. If your cell was the size of an entire baseball field, a virus would be the size of a baseball. That's how teeny tiny they are. They cannot replicate unless they have a cell host to take care of them so that they can start to pump out other little viruses. So that's one of the reasons they're so difficult to treat, is they're hard to understand, and they get inside the cell, and once they get inside the cell, they start making other viruses. And it just turns into a difficult situation. Now, some of the compounds that work on viruses in the natural world do also offer some benefits for bacteria as well. They're not so discriminating. If it's pathogenic, they sometimes play a positive role. But conversely, some of the things that help bacteria, like if you go to the doctor and you have a viral illness, asking for antibiotics is not going to do any good whatsoever. Antibiotics do not touch viruses.
So when you're dealing with a viral infection and you're treating it naturally, is there any, integrative solution there where you're using both natural modalities as well as traditional or Western modalities to treat a virus?
Well, one of the interesting compounds that has a lot of research on viruses and viral illnesses is from bees, and it's called Propolis. Now, bees do not make propolis. Bees collect propolis from trees in their local area, and they bring it back to the hive in little bee pockets on their bodies, and they transform it. They mix it with some fluids and blend it into beeswax. They use this to seal the hive, the little nooks and crannies, and to keep the hive clean and to kill pathogens. They have a very strong anti-pathogenic activity, including against viruses. Now, the health benefits of propolis have been known for a very long time, even thousands of years ago. Topical propolis, using it on the skin for like boils and blisters and such, was a well-known part of traditional medicine. But it wasn't until more recently in Germany that they found that purifying the propolis, removing all the beeswax, making it more powerful, could be an effective oral medication. And they started to do some clinical research on how to use this against one of the things they were interested in is herpes simplex, the virus that causes fever blisters, that causes those herpes lesions on the mouth that can be so unsightly and so very uncomfortable. And they found it could be incredibly helpful, especially in that situation.
Wow. So in that situation, I understand that those things occur, I guess, forever, the herpes or the cold sores, ongoing.
That'd be absolutely. You're right. They're not all viruses. For example, the cold virus. If you catch cold, will propolis help you get over the cold? Absolutely. It will get over 3 to 4 times faster if you use propolis right from the beginning than if you didn't take propolis. The form that we are working with is from Germany, and this German form is called GH2002, and that's the purified propolis that removes all of the beeswax, so it concentrates its antiviral activity more specifically. The other illnesses like fever blisters or HPV or some of these, the virus that causes chickenpox, these stay in your body forever. They hide in your body, and then during times when you become weak or stressed, they rear their ugly heads. So when I worked in cancer care, for example, I had a lot of chemotherapy patients that also developed shingles because they'd had chickenpox as a child. Their immune system was compromised by their cancer treatment, and all of a sudden, boom, there's the shingles virus. So those kinds of things are called chronic viral infections. Unfortunately, even with natural interventions, we can't cure them, but we can sure help put them back to sleep a lot faster.
What about some of the viral infections that are a threat when we're in our healthcare facilities while we're undergoing surgery or being treated?
Well, some of the illnesses that you acquire in hospitals are more bacterial in nature, but the one that can really be a problem is influenza, the flu. Now, everybody's heard of the flu, and they know it can really make you sick, but sometimes they don't understand how very severe it can be, especially for people who are already weak or who have other illnesses. So for individuals who are exposed to flu viruses, and that's something that you might see during flu season in a hospital because someone might be in for to get their appendix removed, but they might also be carrying the flu virus, that I think that using like a GH2002 propolis every day, a little bit every day, will help to hopefully prevent some of those infections. Because if you have an antiviral compound on board in your body already, then exposure to the virus, you may be less likely to become ill, or if you do become ill, maybe not quite so very sick.
Do the same compounds work for those chronic viruses as they do for the viruses that are acute and might run their course in a couple of days or maybe a week? Well,
we do have research on all kinds of viruses. So one virus, of course, everybody's interested in is HIV, human immunodeficiency virus, the virus that causes AIDS. So we don't have a lot of information on using propolis and GH2002 specifically for that virus. I think that in theory it might be helpful, but we don't know for every single virus that's out there. But for the ones for which it's been studied, for example, when we look at HPV, which is human papillomavirus, that can cause, one form of HPV can cause genital warts. The other form of HPV can cause cervical cancer. That's something that using an antiviral like a GH2002 propolis can be very beneficial.
Have you noticed that there's been any a difference in some of these compounds when it comes to either gender or the age of some of the patients?
Yes. When you look at not so much gender, but the older an individual is, generally the less active their immune system is and the longer it takes for the immune system to become activated. That's one of the reasons that somebody who is older sometimes has more difficulty fighting off an illness that a 19-year-old may have no difficulty with whatsoever. So I especially like to use, even though it works very well on both young people and old people, I especially like it when older adults consider using some of these natural interventions so that they can get on board with helping to reduce the severity of their viral illness much more quickly, because if anybody's going to have a complication, it's probably going to be the 70-year-old, not the 19-year-old. However, there's no reason whatsoever that younger people can use them as well, if they're dealing with an acute viral illness like a cold or the flu, to help lessen the severity of the symptoms and get over it faster. Another thing that I really like about using the propolis for these types of situations is that there are other natural compounds that help the immune system. They help make the immune system stronger. And I love them. Everybody talks about taking vitamin C for a cold, or elderberry is another really popular compound. They're fabulous, but they work with the help of the immune system. With propolis, it doesn't necessarily need as much help from the immune system. So even if you're older and have a weak immune system, it can still provide benefits for you. I think it's a truly, truly interesting natural compound that can make a real difference on diseases that are hard to treat. It needs a lot more medical research, but we do know it's safe for people to use. And I think it's a great option for folks who are trying to deal with some of these viral problems.
Can it be considered an option for the prevention of these viruses ever rearing their ugly heads if you, say, incorporate it into our diet on a regular basis?
Well, we don't have as much data on that as we would like. In the drug world, it's a little bit easier to get funding than in the natural products industry for some of these really long studies. It seems that way. If you have a little bit on board, you don't need a full dose, but a couple 100 milligrams of like, for example, the GH2002 can make a huge difference ongoing. We've had a lot of anecdotal reports of people that use it to help prevent illness. But as I said, you would need to have longer-term studies to do that. We have more data on people that are actually ill using it to recover faster.
Well, now, give us a couple of resources that we can direct our listeners to go and get more information about viral infections and some of these natural ways to deal with them.
Well, if they want to learn more about propolis, like this GH2002 propolis, they can certainly just Google 2000 GH. G is in giraffe, H is in hippopotamus, 2002 propolis, and they'll have some resources. If they're looking specifically for products that contain this, they can always come to our company's website, which is europharmausa.com. Euro like Europe, pharma like pharmaceutical, USA like the United States of America.com. And there's some information on propolis as well.
Some great information. Thanks for sharing with us today, Cheryl.
Thank you so much for having me. I enjoyed it.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Cheryl Myers, registered nurse, natural health expert, lecturer, and author. And she's been talking about some safe, natural, and effective solutions to treat common viral infections. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in on SoundCloud, and be sure to visit our affiliates page when you visit our platform at hpr.fm and healthprofessionalradio.com.au.